For therapeutic exercise activities, the slide tube can be very beneficial. So let's say we wanted this patient to begin to do some active or active assistive knee flexion. We could slide the slide tube just under that one leg.
Focusing on tucking it under the knee and the ankle. So I've done that fan fold, and then Mary can thread it through.
You can slide it there, and then we'll ask the patient, can you begin to bend your knee? And there you go, push that leg down straight. So he's bending and then straightening, flexing and extending at the knee. That hip gets some early mobility, and you don't want to have to lift and have the patient have all that friction on the bed. You can use your slide tube, tuck that under the knee, tuck that under the ankle, kind of fan fold it over your hand so it's easy to slide under the patient's leg. Pull that through under the leg there, and then you can ask that patient to help abduct the leg. So can you push your leg out sideways and bring it back inward? And you can apply resistance as needed, or adjust as the patient, as whatever the goals are.